Little Leo is getting his MMR vaccination to protect him against catching measles, mumps or rubella.
There's a good boy. Yeah, I want to be comfortable in the knowledge that we've done everything we can for our little ones so they don't end up with any problems later on.
But the fact is that since the start of the COVID pandemic in March 2020, there has been a significant drop in the number of people getting their children vaccinated against MMR and other childhood illnesses, and that is across the country. Now, there could be a variety of reasons for that. Some people say they just didn't want to bother the NHS, but it's causing serious concern among health officials.
The pandemic has really reminded us just how important vaccines are. And with the childhood vaccinations, it's not only important that you have your vaccines, but it's really important that you have them on time. We know that with measles, mumps and rubella vaccine, they're protecting against really serious childhood illnesses, particularly measles, which is actually much more infectious than COVID.
In Somerset, just under 91% of children aged 5 have had their 2 doses of the MMR vaccine. Now, that's below the 95% which the World Health Organization says is needed to achieve and sustain the elimination of measles. And this means that 1 in 10 children aged under 5 aren't fully protected from measles and are at risk of catching it. The latest data shows that MMR vaccination uptake has dropped to its lowest level for 10 years, although it is relatively stable in the South-West. Well, now the UK Health Security Agency and the NHS are launching a national campaign asking parents to make sure their children are properly protected by getting the jabs at the right time. And public health officials in Somerset are urging parents not to ignore the warnings.
Children are routinely offered their first dose of the MMR vaccine when they're 1 year old, and a second dose when they're around 3 years, 4 months before they start school. We know the pandemic's got in the way of everything, including child vaccinations. If you're unsure of whether your child has had the full course of the MMR vaccine, you can check in their red book or you can phone their GP surgery. Vaccine's safe, it will protect your child, and it's never too late to catch up.
In a recent survey carried out in the South-West, 39% of parents or guardians of children under 5 didn't know that measles could cause serious health implications. 49% weren't aware that in some cases it can be fatal.
Ready?
Good
1, 2, 3,
boy.
go.
So the message is clear. Think now about getting your child vaccinated and talk to your GP surgery. I'll see you next week.